everybody. Thanks for joining me today, Dr. Ross Marcagiani at Turnpaugh Health and Wellness Center. Today, we're going to be going over our word of the week. The word of the week is going to be heart health. So this is going to be a little bit more cursory overview. If you want something that's a little bit in depth, please dive into my 15-minute video. Otherwise, this is going to be much quicker and a little bit more cursory overview. So if you want someone that wants a little bit more detail, please tune in to that 15-minute video. So we'll be going over, what the heart does, some physiology behind the heart. We'll be going over some signs and symptoms, and then we'll be talking about, how to prevent, poor heart health. Let's dive in here. So some first thing is some stats I wanted to present to you that are really eye-opener. The big thing here is heart disease is the leading cause of death in men and women in the United States. About one person dies every 37 seconds from cardiovascular disease, and a little less than 1 million Americans suffer from heart attacks. So these are some really eye-opening stats that we want to be aware of our heart health. What's the heart's job? Okay, so the heart is like a giant muscle which contracts and relaxes. And what it is pushing out, it's pushing out oxygenated blood to our systemic circulation, to our cells and our tissues. And it's really important because this blood is our lifeline. It carries all of the vital nutrients, it carries our oxygen to these cells and tissues, and also clears debris and clears carbon dioxide. So really important that we have good heart health and cardiovascular health. Now, what happens when we have decreased function? So there's a lot of things that go in hand, but basically we have this external stimulus, whether it be an environmental stimuli, a nutritional stimuli, whether it's genetically related, whether it is a bacteria or some type of infection. We have this stimuli that is not removed and that's constantly causing an immune stimulation, okay? And this immune stimulation for a short period of time would be good, but it's chronic, it's constant. And it's going to basically cause the release of a couple things here. The big things I want you to be aware of, it's going to cause the release of nitric oxide, NO, but more importantly, inducible nitric oxide, which is going to cause reactive oxygen species. So the big thing is that INOS, inducible nitric oxide, causes free radicals to form. And free radicals will basically will drive inflammation. So we have this chronic inflammation at this artery, and it's going to cause that artery to become sticky. And it will cause for the adhesion of platelets, the adhesion of oxidized LDL. It'll cause foam cells to occur, and it will start to narrow the size of that artery and cause that artery to become more rigid. Specifically, would be an example to coronary artery disease. This is the leading issue with cardiovascular disease is the blockage of that coronary artery that's going to eventually decrease the return of blood to the heart. Now, and then this is when we start being concerned about having a heart attack. So what happens here is we have the decreased amount of blood returning to the heart. Now the heart isn't getting oxygen and glucose, and it starts going into a more anaerobic phase and starts producing lactic acid. Then that lactic acid causes basically the heart to kind of seize up. We're not allowed, the heart isn't carrying as effectively an electrical stimuli, and it can't contract as well, and it then has an infarct or a heart attack. And then depending on the length of that heart attack, the infarct, the myocardium, the tissue around the heart, can die. So those are the two big concerns with decreased heart health. But the big thing is that INOS, that inducible nitric oxide, creating more reactive oxygen species, and we have that chronic inflammation. Now, you can see some signs and symptoms here that just things I want to notice or highlight is that not everyone may exhibit signs or symptoms. And the other thing I want people to be aware of is that men and women present much different with signs and symptoms. Men typically left arm pain, left jaw pain. Women completely different. Could just be general neck general chest, just overall chest discomfort. So just being aware of that. SOB means shortness of breath, and metabolic syndrome is a compilation of signs and symptoms such as high triglycerides, uh, high glucose or diabetes, high high weight or obesity, increased waist to hip ratio, high total cholesterol. If I didn't already mention, high triglycerides. So those are all things that you want to look into. That being said, we want to assess uh, your blood markers. So if you're an individual that's concerned, we want to make sure we look at your triglycerides, your HDL, your LDL, your oxidized LDL. We want to look at your fractionated particles, such as your large and small HDL and LDL. We want to look at your CRP, C-reactive protein, which is a marker for inflammation for your heart. We want to look at some genetic markers, your ApoB, your ApoA, your LPPLA2. These are all aspects that will give us some evaluation to the status of your heart health. Now, I want to talk a little bit about nutrition here. So a lot of the times we have so much focus on cholesterol being the main bad guy. Now, there's research that has come out to support maybe that's not necessarily 100% true that total cholesterol is the only marker we really should be concerned about. Here's a study here that looked at dietary cholesterol and coronary artery disease via systematic review, and they fed individuals for an extended period of time about 2 to 4 eggs per day. And they found that after this research was done, that these eggs that are high in cholesterol, the yolk, but also high in choline and B vitamins, didn't really increase their total cholesterol. And so that's something to be aware of. Now, for those individuals, I just want to provide a little bit of an asterisk here. There are individuals who will produce more cholesterol and absorb more cholesterol. So, there will be a caveat for those individuals. And also, let's be aware, we make the majority of our cholesterol internally via de novo synthesis. So about 75% of our cholesterol is made internally, about 25% we consume. So just keep that in mind. Also, with the cholesterol point here, they did a study here, a systematic review of meta-analysis of clinical trials of the effects of a low carbohydrate diet on cardiovascular risk. So basically, again, they fed a population, an obese population, for an extended period of time, a low carbohydrate diet, meaning a higher protein and a higher saturated and unsaturated fatty diet, as well as good phytonutrients in the forms of plants and vegetables. And they found that these individuals had lower cardiovascular risk, meaning lower triglycerides, lower total cholesterol, lower LDL, higher HDL, reduced oxidized LDL, reduced CRP, they lost weight. This is all in connection with reduced risk of heart health. So giving some indication that, fat might not be as evil as we think it is. And then, so quickly, I want to mention exercise is another key point. So the American Heart Association recommend 30 minutes per day of moderate intensity. If you want to figure out, what moderate is, you should be able to carry a conversation while exercising. So 5 days a week for 30 minutes, moderate intensity. Now, if you're an individual who's really comfortable with that, I would challenge you, try doing, anywhere between 15 to 25 minutes of intense exercise 5 days a week. We got to remember, the heart is a muscle. So just like anything, the more we can train that heart, or the more load or demand we can put on that heart in a safe fashion, the more performance we're going to get from that heart. Now, again, depending on your heart health status and depending on your comfort level with exercise, depends on if you can, jump up to that high intensity exercise. Now, for those who don't know what high intensity is, if we're just, again, going to the breathing rate, you should be able to feel like you have an increased breathing rate, but and should be able to basically answer yes and no questions, but should not be able to carry a full conversation. Okay, so just be aware of that. And then what are some nutrients that we can take? We have vitamin C, we have omega-3 fatty acids, These are really good anti-inflammatories, as well as omega-3s helping increase your good or cardioprotective lipid markers such as your HDL. And remember, the importance is trying to quell that or quench that inflammation. Methylfolate has been helpful because it's shown to be effective in maintaining healthy blood vessels. Now, we talked about that INOS briefly, the inducible nitric oxide. Well, there's something called ENOS, which is endothelial nitric oxide. This basically causes the arteries to vasodilate, meaning widening, which allows more blood flow. And it also enhances our mitochondria, which are the powerhouse of our cells. Mitochondria are in every muscle, so we have mitochondria in our heart. Remember, our heart is a muscle, so it's going to. So remember, this ENOS is going to improve blood flow, and it also improves mitochondrial function. So some things that to improve that ENOS are going to be arginine, magnesium, mainly in the form of magnesium citrate, but I'd recommend taking a blend of magnesium citrate, glycinate malate, L-glycine, citrulline, vinpocetine, huperzine A. These are all aspects that will increase that ENOS. So I hope this helps. This is really important for those individuals who aren't sure where their heart health is. Get the testing done. Get your triglycerides looked at. Get your some of your genetic markers looked at. Getting an assessment on your heart health. Please share this with anyone that can benefit, and I appreciate your time. Thanks for watching.